Good evening and welcome to your trusted evening bulletin on DV Real News TV. I'm Jojo Zaza, and we begin tonight's program with a landmark development from Nigeria's National Assembly that could change the course of public health history in the country. In a moment widely hailed as a turning point in the fight against malaria, the Nigerian Senate has successfully passed the second reading of a bill that seeks to establish the National Agency for Malaria Eradication, a dedicated body that will centralize, coordinate, and accelerate national efforts to eliminate the deadly disease. The bill, which is being championed by Senator Nyesom, represents a bold and historic step in the quest to end a long-standing epidemic that continues to claim hundreds of thousands of lives annually across sub-Saharan Africa, with Nigeria, unfortunately, accounting for the lion's share. The legislation, officially titled the Malaria Eradication Agency Bill, SB.172, received resounding support during its second reading on the floor of the Senate, with lawmakers citing the urgent need for an institutionalized response to one of the country's gravest public health threats. Senator Nyesom, who has been at the forefront of malaria eradication advocacy in both Nigeria and across the African continent, praised the Senate's action, describing it as a bold endorsement of national healing. According to the lawmaker representing Delta North Senatorial District, the creation of a specialized agency is no longer an option. It is a national emergency and a moral imperative. I quote, "This is a moment for bold action. Malaria is not just a disease, it's a structural and economic burden. The Senate has shown leadership, and I am confident Nigeria is ready to lead Africa out of this epidemic." Senator Nyesom. Senator Nyeso's passion for malaria eradication is not new. Over the years, he has invested heavily in health research and vaccine development, personally funding initiatives that aim to produce local solutions to a persistent African problem. According to reports, he has committed more than $20 million to support pharmaceutical production, medical innovation, and public health awareness in the malaria space. The senator's commitment goes beyond politics. It is deeply personal. In past interviews, Nyesom revealed that his foundation has reached out to over 20 African countries, building coalitions, sponsoring research, and advocating for a regional malaria eradication strategy. He argues that without a centralized agency, Nigeria will continue to fight a losing battle. His proposed solution, the National Agency for Malaria Eradication, or NAME, as the bill defines it, would operate as the nerve center for all anti-malaria policies, overseeing vaccine research, national treatment standards, environmental sanitation programs, and disease prevention education. The agency will also manage partnerships with international donors, development agencies, and health technology providers. According to the interview with health analyst Dr. An agency like NAME could be a game changer. Right now, malaria control is fragmented. NGOs do one thing, state ministries do another, and there's no strong national framework. If implemented effectively, this bill could change all of that. And the timing couldn't be more urgent. According to the World Health Organization's 2024 malaria report, Nigeria accounts for over 184,000 deaths annually, out of a global death toll of just over 600,000. This means nearly one-third of global malaria deaths occur within Nigeria's borders, an alarming statistic by any measure. But the impact of malaria extends beyond health outcomes. Studies estimate that the disease reduces Nigeria's GDP by as much as 1% annually due to reduced labor productivity, increased absenteeism, and out-of-pocket treatment expenses. Families bear the brunt of the economic cost, often choosing between medication and meals. Senator Nyesom emphasized that the establishment of NAME is not just a healthcare reform, it is an economic recovery strategy. He urged his colleagues across party lines to treat malaria as a cross-sectoral emergency requiring total national mobilization. Quoting his address on the Senate floor, Nyesom stated, "True and lasting change requires collective action, government commitment, private sector involvement, and strong international collaboration. We cannot afford to lose another generation to a disease we have the tools to eliminate." Senator Nyesom addressing Senate, roundtable discussions with health experts. The legislative proposal outlines a robust structure for the agency, including divisions dedicated to a vaccine development and clinical trials, a environmental control and sanitation, a mass education and behavioral change campaigns, a data analytics and disease mapping, a grants and funding for state-level implementation. The bill also seeks to leverage modern technology, proposing the deployment of drones for spraying stagnant water sources, smart diagnostics for remote areas, and integration of AI-powered disease tracking systems to predict outbreaks and allocate resources in real time. Support for the bill has been growing across key health institutions. The Federal Ministry of Health, through its coordinating minister, Professor P, has endorsed the initiative, saying the government is committed to not only fighting malaria but also fostering a pharmaceutical revolution in Nigeria. Professor Pate emphasized the need to localize vaccine production and reduce dependency on foreign imports. A public hearing on the bill is scheduled for June 2025, during which experts, civil society organizations, traditional leaders, and the public will be invited to weigh in on the agency's proposed structure, powers, and funding mechanisms. The atmosphere in Abuja has been one of cautious optimism. While the bill has passed the second reading, there are still hurdles ahead. Chief among them is budgetary allocation. Critics have raised concerns about Nigeria's ability to fund a new agency amid existing fiscal constraints. But proponents argue that the cost of inaction is far greater. Look, Nigeria spends over ₦1 trillion annually treating preventable diseases. If this agency reduces malaria cases by even 30%, it will pay for itself within 5 years. As Nigeria prepares to host the African Summit on Health Innovation later this year, the country's renewed drive to eradicate malaria is expected to take center stage. International organizations such as the Bill and Melinda Gates Foundation, WHO, and the African CDC are closely monitoring the progress of the bill. Senator Nwako has extended an invitation to global health stakeholders to partner with the new agency once it is established, pledging full transparency and results-based accountability. In summary, the Senate's decision to move this groundbreaking bill forward has injected new hope into the fight against a disease that has haunted Nigeria for generations. With bold vision, bipartisan support, and national urgency, Nigeria may soon become a leader in malaria eradication, not just a statistic in its tragedy. We bring you developing news from Port Harcourt, the capital of Rivers State, where political tensions flared into chaos during a town hall meeting earlier today. What was meant to be a civic dialogue turned into a volatile confrontation as supporters of the Rivers State Governor, Siminalayi Fubara, and loyalists of the former governor and current minister of the Federal Capital Territory, Nyesom Wike, clashed in a heated altercation. The town hall meeting, organized to foster dialogue between local government stakeholders and the general public, was held in a prominent civic center in central Port Harcourt. Attendees included political figures, party supporters, traditional leaders, and concerned residents, all gathered ostensibly to engage in discussions about governance, infrastructure, and peace-building within the state. However, the event quickly descended into disorder as simmering political rivalries between supporters of Wike and Fubara erupted. What began as verbal exchanges soon escalated into shouting matches, with opposing chants echoing through the hall, causing panic among neutral participants and civil society observers. Security personnel were seen intervening as both camps refused to back down. Officers from the Nigeria Police Force, alongside private security operatives, were deployed to restore order and prevent further escalation. Several eyewitnesses reported scuffles and shoving between individuals from both factions. For context, the relationship between Governor Fubara and his predecessor, Nyesom Wike, has grown increasingly strained in recent months, despite Wike's initial endorsement of Fubara during the 2023 elections. Political analysts have pointed to deepening divisions within the People's Democratic Party, PDP, in Rivers State, with the once unified front now marked by internal rivalry and factionalism. The meeting had been advertised as an open forum for community engagement, part of a statewide initiative to bridge gaps between the government and its people. However, political undertones and long-standing grievances hijacked the agenda, turning a civic event into a battleground of influence. According to eyewitness, everything was going fine until they announced some names. Immediately, you could see people start murmuring. Before long, it became a shouting contest. We had to leave, it wasn't safe anymore. No major injuries have been reported so far, though some attendees were treated for minor injuries sustained during the scuffle. At least 3 people were escorted from the premises by security for causing public disturbance, and a 4th person, reportedly an organizer, is currently assisting the police with their inquiries. Meanwhile, both camps have issued conflicting statements through their respective spokespersons. A representative of Governor Fubara described the incident as a deliberate attempt to undermine the peace-building initiative of the state government, accusing unnamed political elements of inciting unrest. Conversely, supporters of Wike argue that their presence was legitimate, and they were merely exercising their right to political participation. They allege that the event had already been manipulated to sideline certain voices critical of the current leadership. Political observers are warning that if these tensions remain unresolved, they could spiral into larger-scale unrest, potentially destabilizing the governance process in the oil-rich state. Political analyst, Dr. said, I quote, "We are seeing a dangerous politicization of civic spaces. What happened today is not just a disagreement, it's a reflection of deep political cracks that must be addressed if Rivers State hopes to move forward." The Rivers State Police Command has pledged to conduct a thorough investigation into the incident. Authorities are also calling on political leaders to tone down their rhetoric and encourage peaceful engagement among their followers. This latest disruption highlights the growing fragility of Rivers State's political climate. With upcoming local elections on the horizon and unresolved tensions within the ruling party, all eyes will be on Port Harcourt in the coming weeks. DV Real News TV will continue to monitor the situation and bring you verified updates as they unfold. For now, we urge all stakeholders, from political leaders to grassroots supporters, to act with responsibility and prioritize the safety, unity, and democratic integrity of Rivers State. This has been DV Real News TV. I'm Jojo Zaza. Stay safe, stay informed.